Good morning. My name is Mark Krikorian. I'm Executive Director of the Center for Immigration Studies. And the Democrats, in one of their debates this summer, were asked whether the taxpayer should fund health care for illegal immigrants. And all 10 participants raised their hand and said yes. That's an arguable position. There are arguments you can make for and against that. But the first question you need to answer in this, as in any other policy proposal, is what is this going to cost? And there simply hasn't been very much interest or exploration in this question. And so that's why we're releasing the two papers we're releasing today and having this panel discussion, is precisely to get a sense of what it could cost. It's not definitive. These are estimates. Maybe they'll be different. Other people have other estimates. We'd love to see them. But nobody really has offered some concrete examination of what the consequences for taxpayers would be of these proposals. And so today we're releasing two papers to look at that. The first is a look at what the current costs to taxpayers are under current policy. The second is what the likely, under a couple different scenarios, costs would be. And this is a topic that needs to be injected into this debate if the debate is actually going to be constructive and meaningful. And so participating in the panel are going to be some of the authors and a commenter. And the first will be Jason Richwine. He's an independent policy analyst who's written on immigration as well as other issues. He did the paper on what the current costs are. Jason's a PhD in policy analysis from Harvard, is published not just on immigration but other issues, for instance, education funding recently published at the Wall Street Journal and elsewhere. Next will be Stephen Camerata, Director of Research at the Center for Immigration Studies. He's the lead author on the paper estimating what the likely costs in the future would be if illegal immigrants were to be covered under health care. Steve is, for more than 2 decades, has been one of the top analysts of the immigration issue. His PhD is from UVA in policy analysis. And then our commenter, discussant, if you will, is Chris Pope, who's a senior fellow at the Manhattan Institute, and he's going to be responding to the two papers and then maybe more generally to the issue of the effect on taxpayers of covering illegal immigrants for health care.